Welcome to the Pain Free for Good podcast, where we rediscover our body's natural ability to heal. This space is for those who have experienced chronic pain, illness, disease, or emotional trauma, and are ready to reclaim the power within themselves. Here, we explore healing, awareness, and the quiet wisdom already living inside of all of us. I'm your host, Heather Peterson, and I'm so glad you're here. Welcome back to the Pain Free for Good podcast. We are so excited with our next guest, Dr. Brad Fanestil. He has been a board-certified internal medicine doctor for 33 years. He completed his internal medicine residency at UCLA and began working in a public clinic in LA. After moving to Boulder, he had a traditional internal medicine practice for 17 years. And in 2009, he became the director of inpatient care at Avista Hospital, where he oversaw the ICU and treated acutely ill patients. In 2011, he began working for Boulder Community Hospital, doing the same. And in 2018, he began reading about the new neuroscience of pain and the brain and started applying some of those new ideas to his primary care patients with chronic pain. And today, he helps bring this new neuroscience into the primary care exam room to help patients learn that there is a way to cure or improve most chronic pain and many other hard-to-treat medical problems. I was first introduced to Dr. Fanestil through my husband's podcast, Harnessing Your Wealth, a few months ago, and we co-hosted Dr. Fanestil, and he shared his story, and I could not wait to have him be on my podcast to share what he does and how he helps his own patients today. So welcome, Dr. Brad Fanestil, to the show.
Yeah, thanks, Heather. I'm excited to be here because I love talking about this stuff.
Heck yeah. You and I share the passion of the mind-body connection, and I love your enthusiasm. And so if you want to start out kind of telling us your story, how you came about getting into this whole thing.
Yeah, I got I'll spare you the longer version, but basically, let's see. There's several different starting points, but really, it probably started when a patient of mine with long-term back pain, who I'd known for at least a decade, came and told me that his back pain was better after he read this book. And I'm like, what? Your back pain can't get better from reading. I've been holding your hand for 10 years with this. What do you mean? Anyway, it was a John Sarno book and called The Divided Mind. And he showed it to me, and I said, I read Sarno's book called The Mind-Body Prescription probably 15 years ago. I know right where it is, in the basement in my house. I know, yeah. And I thought at the time, he's onto something. But at that time, I had 3 little kids, and I was working way too many hours a week. What was I going to do with that? But this time, I got that book back out when I went home that night, the Mind-Body Prescription, and read it, and I got The Divided Mind. And anyway, started down the path, read that, ended up at a conference in Santa Cruz in Cal. I went on the internet, started nosing around for this stuff, and I found Howard Schubner and Alan Gordon were co-leading a weekend-long sort of retreat conference educational thing in Santa Cruz. I flew out to that a few months later and came back from that weekend going, holy crap, this applies to 4 or 5 people a day in my internal medicine practice. And I like to tell people I didn't switch gears because once a month some wacko like Heather walked into my office who couldn't deal with her crap, and I needed to teach her how to cope. That's not what this is. This was 4 times a day of people walking into my office with problems that Western medicine and I couldn't fix. And now I'm like, oh, well, now I know how to fix it. And within the first week or 2, I had a few sort of miracle get better cases that just further pushed me down the path. And then eventually I just said, I got to switch gears here. And so I
That's incredible.
Switched gears. Yeah, and this is what I do now. It's just, I've got a clinic called Boulder Institute for Mind-Body Medicine. And now I only treat all the people I used to not want to see.
Oh, wow. Okay, so what does that typically look like for you, and how did you open up your own practice? How did that go? What was it like leaving modern medicine?
Yeah, the medicine community is, I was kind of lucky being in Boulder. very sort of new agey to some extent, but also very open to like, hey, what's next? Let's see. I actually went to the hospital. And in fact, what happened, I can remember this very clearly. I had a different patient. This is a different patient who I was bringing these ideas to, and this guy had chronic pain for many years. He was a young guy. He was like in his late 30s. And he ran a business from his couch because he could barely get off his couch, but he was flipping houses. He would find them on the internet, and he had a crew of people who could do stuff, and he'd say, hey, we're going to do this. And he had a pretty successful business flipping houses, but he wasn't doing the work, and he had back surgery, and he was on narcotics, and he was on narcotics for years before I met him. And anyway, I had been his doctor for a few years, and I remember walking out of his exam room. This is maybe 8 months later after I'd been to this conference, and telling some other doctors in my office, and I was in a group of 5 there. Everybody knew this guy. And I said, if this guy ever gets better using these tools, I'm quitting. I'm going to just drop this, and I'm going to go do just mind body. And sure enough, about 6 months later, this guy comes in, and he's like, I'm off my drugs. I'm like, I don't have any pain. This is what. So true to my word, I sort of like, oh, God, I got to quit. So I went to the administration. At that time, I was an employee of the hospital. And I went to the hospital administration. I said, I'm quitting. My contract's up in a few months. And I'm not sure what I'm going to do, but I'm going to go hang a shingle and do this mind-body thing. And in Boulder, the hospital's response was, wow, our board of directors just came to us and said we should get an integrative medicine clinic. I mean, we're Boulder, for God's sake. This is Boulder Community Health, isn't it? You're integrative, right? What you're talking about? And I'm like, well, yeah, that's a very specific type. I'm calling it mind-body medicine. I'm not going to do functional medicine, and I'm not going to do some of these other things that could be integrative. I'm doing mind-body. And they're like, okay, well, we know you. Okay, so I ended up starting a clinic with the hospital. I remained employed. They just moved me over from my primary care to this in 2019. And then for 5 years, I had a clinic at the hospital. And just started that way. And then 5 years later, the hospital's like, look, you're not making us any money. You don't recommend procedures, you don't prescribe drugs, you don't send people for more back and knee surgery. In fact, you're telling them not to do it, and we just can't afford you. And I looked at that, I said, well, I don't lose any more money than all these other primary care docs. I mean, look at the balance sheet here. And because primary care is a loss leader for medicine. They're like, oh, well, we can pay the primary care docs some money, and we don't quite cover. They got a lot of overhead, but boy, they get the people in for surgeries and labs and x-rays. I wasn't doing any of that, and so they're like, we can't. So 2 years ago, I left the hospital and just hung a shingle in Boulder here, and I've got a little one-room clinic, and I do a lot of stuff on the internet, and I got a little YouTube channel, and I see a lot of patients via internet now.
Wow.
I didn't used to do, and I also see in-person patients in my office.
Very cool.
Yeah.
Did you experience a lot of skepticism from your colleagues when you left?
Not, no, I think, I'd been in such the mainstream community. I mean, I was working closely with so many of the specialists in the hospital. I knew them all. We share patients, and I think I was, reasonably respected as a guy who kind of knew what he was doing. So I think there was a little bit of like, oh, look what Brad's doing. But there was also, especially from the primary care doctors and I would say the neurologists who see a lot of things that nobody knows what the hell's going on. A lot of referrals. I mean, I got busy in a hurry and had a long wait list because I was in the hospital. So I took all insurance. I took Medicaid because the hospital took Medicaid. So, no, I had a long waiting list. And most of the people in those years I was with the hospital, when they came to me, didn't know why they were coming to me. I'm like, why are you here? I don't know. My doctor told me I should come see you. I mean, maybe there was some, but I didn't get a lot of... I had a lot of docs who, they didn't really understand it, but they were happy to have somebody to refer their fibromyalgia patient to, because they didn't know what else to do. And when I'd explain it to some of them, I'd say, okay, so we start with some education about how the nervous system works, and get them to understand, do you see what your nervous system's doing? And they're like, wait, they have to understand something first, and then they're going to do something. That sounds like kind of the placebo effect. And I'm like, okay, you can call it that if you want to. I don't really care what you call it. And then there was certainly in some spheres in the medical field, even in Boulder, there was some like, yeah, all right, whatever. And I'm like, what do you mean, whatever? This person's been miserable for 10 years and now they're not anymore.
Yeah.
It's a lot more than whatever. But.
Wow, that's incredible. What a great story. And do you find that there's a lot of doctors shifting out of medicine into the mind body world at all, or is it far and few between
Yeah.
still?
No, and it's hard to do both. I teach a class called an advanced pain reprocessing therapy for an online company. So these are doctors and clinicians, psychologists and doctors and other clinicians who have taken basic, like how do I bring this to my patients, and then they want a little more. So I teach their what they call their advanced class. And there's invariably it's usually if I have 40, 50 people in the class, 2/3 of them are psychotherapists. No, yeah, half are psychotherapists, another third is physical therapists, and then the remaining, whatever that is, a fifth or whatever, is physicians.
Hmm.
And so there will just recently, I'm thinking of this because just recently there's a guy he works in the UK and he's a pain doctor, so he injects spines and all this stuff. But he's very interested in this work, and he was asking me, "How'd you get into this? And how'd you switch over? And what is it?" And I told him I tried to do both at once. I couldn't because this is not a 15-minute office visit. This is a little longer to help people, and I found I just couldn't do both and meet the expectations of being a primary care doctor and seeing all these people and filling refills. So I had to completely switch over to do this. And so he's in the process of thinking about this, like, gosh, should I switch over? Because he sees the value of this. So just to give you an idea, are more doctors coming along though? That 2018, I think it was, maybe it's 20. I think it was the 2018 conference that I went to that I talked about in Santa Cruz when I was first getting into this. So this is a weekend conference run by two of the sort of leaders in this field, Howard Schubner and Alan Gordon. They were working together at that time to teach this little thing. And I remember on day one, we're all staying at this nice little, place in the woods with feeds you good food, and you go to these conference, you go to the little lectures, and it was just the two of them. There were no other lecturers. It wasn't some big meeting. But I remember Howard looking out and go, "Okay, we got 28 people this year, and 3 of you are MDs. It's the first. We've done this 3 years in a row. It's the first time we've had any MDs here, so that's good. We're
Wow.
making some headway."
Yeah.
Now Howard teaches a course online. I think he does it twice a year for clinicians, mostly MDs, although psychologists too. So I don't know what the split is there. And he usually has about 400 people twice a year.
Wow.
And so there are hundreds of physicians now taking his class, never mind other classes, this thing I'm teaching and other things around there. So yes, it's definitely becoming a thing. But despite this is hundreds, online, we're talking about from around the world.
Wow.
So the percentage is still not high. There are definitely still doctors who are skeptics. There are a lot who are like, okay, sounds interesting. I'm not that interested, but I might send you a patient or two. Then there's some on the further end of the skeptical spectrum who are like, what a bunch of bullshit. But I think there are more and more, and especially I would say primary care docs who deal with the whole person all the time. I mean, most good primary care doctors, general practitioners, family docs, they are kind of holistic doctors. They
Yeah.
see the whole person, they see their life, they see the family, and they recognize a lot quicker than a lot of the specialists that, okay, there's something else going on with health than just this little biochemical thing that we identify.
Hmm.
There's some other things. So they're, in my experience, quite open to this and very glad that there is sort of another niche or place to send people.
That's awesome. Very cool. So what does it look like for you when you're seeing a patient?
Well, it
Is it
depends
different
who the
depending on their diagnosis or
not the diagnosis almost doesn't matter
yeah.
because there's a William Osler is said to be he's sometimes said to be the father of internal medicine. He was one of the founders of Johns Hopkins Medical School back in 1920ish. I want to say I don't know exactly when
Mm-hmm.
it was. And he's a brilliant guy and one of the forefathers of just bringing modernity into the medical field. And
Mm-hmm.
we're not going to be drawing blood or using leeches and bloodletting anymore. We're starting to identify some biochemistry here and some way the body works. So anyway, he said that I might get this a little wrong, but he has a lot of famous quotes. He's a pretty pithy guy, pretty witty guy. But he said the new physician has 20 drugs for each disease. The
Oh
old
yeah.
physician has one drug for many diseases. And so that's kind of how I feel when you ask, does it matter what the diagnosis is? From my mind, I'm the old guy. I'm like, I got one thing here.
Mm-hmm.
Now, you have to have done the due diligence before you do my one thing. Actually, you don't. You can use my one thing for almost anything, but I would never recommend it as the only mainstream first line treatment if you have type 1 diabetes. I'm like, you know what? Why don't you get on some insulin? Type 1
Yeah.
diabetes used to kill 100% of people who got the diagnosis until insulin was discovered. So,
Wow.
no, there's a real value to mainstream medicine. Let's
Sure.
do that part first. There's some great things. But once you get past that and mainstream medicine is throwing up their hands or rolling their eyeballs or shrugging their shoulders, then it's time to go, okay, great. You've done the due diligence. Now let's turn to the nervous system. So now, whether you have refractory migraine headaches, refractory meaning nobody can get rid of them, refractory
Yeah.
migraine headaches, or you have irritable bowel syndrome, or you have chronic back pain, or chronic neck pain, or you have interstitial cystitis, or you have pudendal neuralgia, or you have long COVID, or I can go on with it, whatever you have. Once you've done the due diligence and Western medicine doesn't have an answer, I'm like, okay, let's turn to the nervous system here. So no matter what your diagnosis is, I'm like, we're going to treat the nervous system.
Yep.
That's sometimes a conversation with people to help them understand how this is coming from your nervous system, not from your back or your stomach. No, the symptoms are very real. The symptoms are in the back and in the stomach.
Absolutely.
Sometimes the stomach's bloating out to here. I can see it. These aren't some made up thing that your brain just thinks you're having a problem. Your brain is creating a real problem in the gut. Your nervous system is really screwed up the way it's running the gut, and that's visible. Whether that's in, I don't know, your bowel movements or the sides of your belly and the bloating, or if that's for a GI problem, or in your back. The back muscles might be incredibly tight. That's super real. There's nothing fake about that. I can feel these rock hard muscles. My contention here is that if it didn't go away right away, that's more than just some muscle that won't go. That's your autonomic nervous system
Yep.
controlling the muscle. So the conversation starts, there's two things I thought. One, no, it doesn't matter what your diagnosis is to some extent, although there's a large degree of helping people come along and understand why I'm going to treat this the same, or I'm going to give you the same set of tools in general with your chronic pelvic pain. I'm going to give you the same set of tools that I'm going to give this chronic migraine person as a general rule.
Yeah.
And once I realized that, which took me a while to get to, is why I teach classes on this. I'm like, you know, I can teach this in a class. I'm teaching the same. We're not teaching you anything special about we're teaching you about your nervous system, and we all have that. And all of these people, once you calm that down, will notice improvements. But the other thing I thought of when you asked that question, where does the conversation start? It starts in a much different place now than it did 5 years ago. 5 years ago, everybody who came to me was like, I don't know, my doctor said, I don't know, I read some pamphlets that you put out. I saw one thing. Now, almost everybody I see is like, well, I've read this book and that book, and I've watched 10 of your videos on the internet, plus I've read Alan Gordon's book, and I'm doing good, or I have a coach, or I've been working with a Curable app, and so almost everybody now is at least partially down the road, and so then I kind of have to figure out, well, how far down are you? Where are you? I love seeing people who are stuck at some place, but that's also a different conversation than it used to be a few years ago.
Oh, sure. I feel like knowledge is power when it comes to this. If you can educate yourself on how it began, then that's the root cause. We're wanting to understand the root cause. We no longer are concerned with managing the symptoms. We're more concerned with overcoming the pain at this point, overcoming the disease, and moving forward. A collective consciousness is evolving, and it's more mainstream to understand these concepts. It's no longer a foreign thing. When I first started doing this in 2018, everyone thought I was so woo-woo, witchy, this and that, and not everything's, related to the mind and the emotions. And I had a real struggle with trying to get people on board. And so it's so awesome to hear that you're seeing the same thing. A lot of my clients I'm seeing nowadays are way further along down the road than when I first began this. And it's refreshing to know that this is no longer considered taboo or anything. People are really grasping and understanding. I want to overcome this. I see the potential. Just like Dr. Joe Dispenza says, we're no longer running the 7-minute mile. It's lower. We're running the 4-minute mile, and people are seeing and knowing that it's possible to overcome these diseases and this pain. And so it's no longer like such a weird idea in your mind to overcome something.
Right. And I think a lot of the reason that we're able to, or part of the reason that the our general, the collective unconsciousness or the collective consciousness or whatever, our general understanding of this is changing, is due to the fact that we are starting to be able to explain what's happening in some real neuroscience terms,
Yeah.
even though it's not really new or different. I would say that there are some Eastern medicine traditions that have identified this long ago using a totally different language,
Oh, sure.
energy or whatever. The
Hmm.
Western medicine was like, well, I don't know. But now we actually have tools and measurement tools that we can see, oh, wait a minute. When people, here's a 1 week or 1 weekend meditation retreat, and we measured
Hmm.
blood before and after, and the before blood had a lot of inflammatory markers, and the
Hmm.
after, just 3 days later, doesn't. And that's different than these people who went on a different kind of retreat where they did some other, I don't know, they did painting or they did something else relaxing. That there's
Hmm.
certain things you can do to your brain that change it, that actually change physical things in your body. And there's just now hundreds of these kind of studies that what you do with your mind changes things. When you get better from whether it's depression, anxiety, or any of these problems, this improvement doesn't happen in the ether. It happens in
Oh.
your biology. Your
Hmm.
brain controls your biology.
Hmm.
And so this new understanding and our ability to see brain circuits on functional MRI imaging, our ability to measure really detailed things down to which genes are turned on and which ones are turned off, you can show that, oh, my brain, or what I did with my mind changed the way my white blood cells turned on genes. And you can measure
Wow.
this on a blood test. And so now Western medicine can come in, and that's what we like metrics in Western medicine. We like
Hmm.
measurement. I mean, you can't. And
Yeah,
to
you
our
want to
credit,
understand it.
yeah, that's what's a great thing. The scientific method is so fantastic because we say, no, let's see this. I don't want to hear your theory about this. Show me the proof here. And we're starting to be able to show actual proof that, see, this thing changed. And now you get doctors going, oh, well, wait a minute, that's a lab abnormality that actually shifted. Okay, maybe I will start accepting this, even though we're not fully on, or I don't completely understand it. There's a lot of things I don't completely understand that I still I've seen enough data to know that, okay, we'll probably understand it better in 10 years, but we understand it well enough now to let's start doing this.
Hmm. Fascinating. Are you able to take those blood markers and see the progression in your patients, or that's just something you've seen in the studies that have been done?
Yeah, these are studies. These are usually the markers I'm talking about in these studies are pretty esoteric things about oxidative stress and things that you can't just, I can't say, hey, go to the blood lab, go to the
Uh-huh.
lab and, pay $85 for this test or even 200. I mean, these are
Hmm.
weird kind of tests that are really only in research, but in studying like mapping the human genome and watching, well, which set of genes are your white blood cells turning on and which ones are turned off right now. That's not something that a normal lab can do. And also, these kind of things, like every intervention we have, there's almost no intervention that we have that is 100% successful. I guess the one I mentioned earlier, type 1 diabetes. Well,
Hmm.
your pancreas stopped making insulin, and giving you insulin will prevent you from dying. So I guess you could say, well, that's 100% successful, although it's difficult to do, and diabetics can still get problems even with insulin. But and a lot of them do. I don't think we've gotten to the point where we can measure specific things in specific people and say with certainty, see what's happening here. For instance, like functional MRI, which is one of the foundational neuroscience tools that is new in
Hmm.
the last 15, 20 years, we didn't used to have, that we can now say, hey, it looks like this part of the brain has changed compared to a year ago. You started meditating once a week, or you did this pain reprocessing therapy for your back pain, and before we did that, you had a little area in your brain that we associate with back pain. We've done enough of these to know which part of the brain is lighting up in all the bajillions of people with low back pain in long term. That's it.
Yeah.
That stopped lighting up after you did this, and it stayed stopped lighting up a year later. That's really interesting stuff. But the way you see that functional MRI is machine learning. Like a functional MRI doesn't look like a CAT scan where the radiologist goes, "Oh, see that spot here? That's a stroke." Functional
Hmm.
MRI, we're talking about brain circuits, and your brain is running millions, well, billions of circuits at all times, and so it's very tough to tease out the change from the background noise. So the
Mm-hmm.
way we know this is happening now is you get 100 people and you treat them. And you change their back pain doing these tools, and you change that part of their brain, and you put 100 people in the machine. The one person in the machine, you're like, well, maybe it changed. Maybe that's just some background noise. But 100 people, you put, and then you have the computer look at that and go and say, which areas changed? Oh, well, now it's definite. 100 people, look, this isn't just noise. It happened over and over, but it was only
Yeah.
this much. The human eye couldn't see it. So anyway, I don't know that we have any tools yet that definitively say, yes, this is working in you. The tool we have to know if it's working in you is, are you feeling better?
Yeah.
How's your day going?
Yeah, exactly. Are you seeing quick changes with the information that you're giving your patients? Like how long
So,
do you see?
yeah,
Is it just
yeah,
really applicable to, are they putting in the work? Because that's a lot of times what I see. Are you doing the homework? Or are you just here to have someone give you some tools that you don't use?
yeah, yeah. And in fact, you're bringing up a great point. That this is I like to say, mind-body medicine is a form of self-care. I
Yeah.
don't fix anybody. I just show you how your brain works, give you some tools to rewire it, and then it's
Mm-hmm.
on you. So very
Mm-hmm.
early on in this, I remember seeing a kid, I call him a kid, he's probably 30, who comes in and he's got some problem, and I send him home with, okay, here's what I want you to do, I'll see you in 3 weeks. And I gave him some, and I don't even have what I'm doing now. I had a different list of things, but nevertheless,
Mm-hmm.
his job, he knew nothing. So I said, I want you to watch a couple of these videos, educate yourself about how your brain's working, and maybe I gave him a couple of little things he could practice along these lines. But it was clear most of it was he's got to, I need to bring him along that he's got to do this. And he needs to teach himself some stuff. So anyway, I see him 3 weeks later. I'm like, so what'd you look at since the last time? Did you? And he's like, well, I watched half of a video last night before our appointment today, but I kind of got busy. I'm managing my dad's estate, and I've got this or that, and I'm like, look, I get it. Life gets in the way. I understand that, but what did you not understand about our last appointment? We should just stop now,
Yep.
and here's what I'd like you to do, and I'll see you again in a couple of weeks. But
Mm-hmm.
this is not me. You come to the doctor is not going to fix you.
Yep.
So I forget which question you asked, but that's one tangent my brain went off. You asked when you did
No,
that, but I
I,
know I
I
had
see this.
13 other things to say.
No, you're good. I see this a lot with my own clients that come to me and, I give them some tools. This is your homework. This is what you're going to bring back to me. And, a lot of them, they do exactly what I say because most of them are perfectionistic overachievers, type A personality, and they're going to do it because, that's the way they are. And then I have others that are, it's more of a suggestion. It's, oh yeah, I didn't quite get to that. And I just really think if you're going to go to a doctor, if you're going to go to a coach like me and you're wanting to overcome the pain, like I guess it really boils down to is how much responsibility and accountability are you going to take for your own health, right?
Yeah, and that's one of the sort of foundational changes in this type of medicine, in mind-body medicine. It is a self-help kind of thing. It's you changing things, and you have to first understand that you can change things based on the newest neuroscience. There are a lot of ways you can access. I often use the term that mind-body medicine. We're going to use the conscious mind to change some of the seemingly automatic processes that are going on in your brain and your body. And we now know there are ways to do that, but I can't do it. I mean, I can block circuits and I can numb sensations. I got all sorts of drugs that numb sensations,
Sure. For a
but they
short
don't
time.
change, or even long term, and turn you into a vegetable or turn you into
Oh, yeah.
whatever.
True.
Or just give you side effects that you decide they are preferable to the symptoms, and so you'll live with them. But I don't have a drug that rewires your neural circuitry. That's on you.
Yep.
But we know you do have the ability to do it. It's just that you do have to do something. This isn't just watch this video, change the way you think, and everything will get better. There is some thought process. If you're going to use the conscious mind to change some of the seemingly automatic processes, you got to have the conscious mind on board. I like to say, if the captain of the ship doesn't understand these concepts, your crew will never get the concepts.
Yep.
So the understanding, the pain neuroscience education, the new education about how nervous systems work, that's brain circuitry, not back muscle. Your back muscle is spasming because the brain circuits are telling it to do that different understanding that your brain runs your body does have to happen. But that's just step one, getting the concept. Now we have to train this other part of your brain, and this other part of your brain, which runs your body every moment of your life outside of your conscious awareness, This other part of your brain does not learn by reading books and watching lectures. This part of your brain learns by doing. It's an
Yep.
experiential learner. It learns by experience and repetition, which is how
Mm-hmm.
my autonomic nervous system got the way mine is. This is the autopilot part of my nervous system that runs my entire body. Got that way by my own experience, my own experience and long life of repetition, and it's how yours got the way yours is.
Mm-hmm.
Uh, if we want to change it, we want to start giving it new experiences. And you can start doing that every day with some of these tools that we use in pain reprocessing or in rewiring the brain. But you have to give yourself these experiences. You can't come in and get it once, get one experience from your coach at a visit. Okay, we did that exercise, and then not touch it again. This brain learns by experience and repetition. You
Mm-hmm.
need to keep doing it, and it will learn. And I think the original question was, well, do you see people that get better quickly, or it's so variable. I will say that generically, what pops into my mind when you ask that, and I think on a different day, a different thing would pop into my mind, but I occasionally see people with musculoskeletal issues who
Mm-hmm.
get better very quickly. They're like, I read a book and got better. We've had, you read, I just read one book and I got better.
Yeah.
That can be frustrating for the person who, like, I read that book and that didn't get me better, which is more
Uh-huh.
the norm. But there are
Sure.
people who have an experience like that. They just needed to get the information. And I've certainly seen people, it's super rewarding where, and I've got several fun stories about that where people, basically send me an email the next day and I'm like, what the hell just happened? I saw you one time and blah, blah, blah. And some of those stories are fun to tell. But I see that not super infrequently, or I see it occasionally with musculoskeletal pain as a general rule, but not always by any means. I almost never see that kind of very quick turnaround with what I now think are probably some deeper seated neural circuits.
Sure.
Chronic fatigue syndrome,
Mm-hmm.
MECFS, long COVID. I would say I haven't had an irritable bowel patient who I just said, see what your brain's doing, and they got better the next day. Some chronic nerve things. And in general, another, like pelvic pain,
Mm-hmm.
facial pain, people with
Oh
some
yeah.
facial pain nerve things. I don't see
Mm-hmm.
those get better quickly. I've often wondered if, well, the pelvis and the face, this is just really integral to who we are. This is the
Mm-hmm.
foundation, or in, I think, Eastern medicine, your pelvis
Yeah,
is
root.
chakra one or something.
Uh-huh. Yep.
Yeah, so these things are like, these are deep-seated circuits that it's unlikely. You may intellectually get on board quickly. You might read a book and go, oh, they're describing me. I'm so excited for this mind-body approach. I can see how it might help me. That's fantastic. But
Mm-hmm.
that doesn't mean you're going to get a quick turnaround. It might. It can certainly be helpful. And for certain people in certain situations, the turnaround does seem to be very quick, and that's fantastic. But when it's not quick, that doesn't mean there's something wrong with you. It means, oh, so you've got some more deeply. Okay, let's get into it. We got a whole suite of tools besides educate yourself and be one of these lucky people.
Oh, okay. So when you do run into some of these patients who are taking longer and you're realizing and this is deeper rooted, what's your next move, if you will? What are you going into their family history and seeing their current stress level? Like, what does that conversation look like for you?
Yeah, I start almost everybody. I usually listen to the story, and as that can be helpful to help people understand. So many people, not everybody, can see this right away, but I would say the significant majority of people, once you explain to them the concept that our new understanding, pain is a protective alarm
Mm-hmm.
from the brain to the body, and it's a good thing. When you break your ankle, you want pain. I hope you get it. Yeah, I hope I
Yep.
get pain when I break my ankle. If I don't, then I'll walk on it and it'll get damaged
Uh-huh.
further. So this is a good thing. And we're now starting to understand that all pain comes from the brain as a protective alarm, and we're now starting to understand chronic pain as this as a protective alarm from the brain to the body. We're understanding anxiety the same way, by the way. That anxiety is also
Mm-hmm.
a protective alarm that you want. If you're in a dark alley at night and you hear footsteps, it's actually a good thing. Neither one
Absolutely.
of these is good when it runs long term. So most of the chronic pain and the chronic anxiety that I see is due to what I view as a hypervigilant autonomic nervous system. And
Mm-hmm.
so, and most people, as you're saying this, and or saying it however you say it, well, they can see. Oh, I can see how my nervous system might have gotten hypervigilant. And I say, I see a hypervigilant autonomic nervous system super commonly in people with a history of childhood trauma. It doesn't have to be that. I'm not even going to say it's usually that. I'm just saying that's a place I commonly see it. But there's all
Sure.
sorts of other stressors that can go on in life or things that might do it. But just that little bit gets a lot of people going, okay, I can, yeah. And I like to talk about brains as developing habits or learned neural circuits, which is how brains work. As they develop learned neural circuits. And once that circuit is really well learned, then it's put into the autopilot part of your brain. And now I can ride the skateboard or hit the tennis ball, while I can also talk to somebody on the sidelines, as long as I don't have to, playing super competitive. But day one, I would miss the ball every time if I did that.
Yeah.
Now it's sort of hardwired into me. But you can go through an explanation for people and help them understand that if you've been practicing anything you practice over and over, your brain wires neurons together. If you've been practicing pain or anxiety or tension in the body for months, years, your brain's wired those circuits together. These are learned neural circuits. So that's the first process, is just getting people to understand. You see how, and really reorienting them to take the attention off of their back muscle and towards the nervous system, which is more root cause. But as people start, so I start with the body, and we have body based exercises of observing sensations. I like to say your brain's fear cycle. Sensation comes in from your back, and the brain goes, "Uh-oh, not that again." What does the brain do saying, "Uh-oh, not that again"? Just sends more protective alarm to the body. So we have this pain, fear cycle. So I usually start over there in that part of the thing that's keeping the brain hypervigilant, is this cycle and this habit that it's just in a habit loop. Can we start watching our sensations differently? And that's sometimes a quick, easy thing. More often it takes a little time for people to even understand, what do you mean watch the sensation without fear? It's screwing my life up. How can I watch it that way? So that takes a few conversations. But at some point, and it's usually fairly early on, I guess, for many people who are stuck or who have trouble watching things without fear, or even if this is helpful, but they're sort of, okay, that's useful and I'm getting somewhat better. At some point, it's time to move over to what I call the under the hood stuff. And let's start talking about some of these and figure out what's going on under your hood that's keeping you like this. Because I like to say there are two things that keep your brain hypervigilant. And one is just this habit that it's been in. Sensation comes in, the brain automatically, habitually goes, uh-oh. And that's one set of tools that generically I might call pain reprocessing tools. But the second thing that keeps your brain hypervigilant is what I call under the hood stuff. And that we need to access more specifically and more directly and more explicitly, access some emotions that are also, because emotions can keep me like this.
Oh, yeah.
Maybe they're buried emotions, repressed. I don't even know I have them. That certainly happens. But it doesn't have to be that. Any emotion can keep my brain on edge. So we want to, I like to say one of the central precepts of mind-body medicine is we want to get out what's in. And there are ways to get these emotions out that don't involve months and years of psychotherapy. They do involve acknowledging that this emotion is there, but whether you actually have to spend weeks or multiple visits, okay, let's go into what happened there with your mom or whatever. I find that to be a little, now I'm moving into psychotherapy, and I always say you can't psychotherapize the lizard brain. This is not something that the part of the brain that's running these circuits, that's keeping your body tense, whether that's anxiety or muscle or running your GI tract wrong or keeping your nerve fired up with pudendal neuralgia or whatever problem you have. The part of the brain that's doing that isn't your thinking brain, and you are going to think your way out of this. We do need the thinking brain to change. Like I said, if the captain of the ship doesn't get these ideas, the crew won't get them. But that's not where these circuits are. The circuits are down here. And this part of your brain doesn't learn with books and videos. This part of your brain learns by doing. So we're going to use a different set of tools to get at this. And I'm off on a tangent again and forgot how I got here.
You're good. I love the tangents. I think that's great. And I think there's, definitely different avenues to hit, all different. Of course, one patient or client is going to present differently and recover quickly or not. And you're going to have to come with your full toolbox and analyze them and see where you're going to go from there and give them the right tools at the right moment and for the right conditions. And
yeah, and often I'll ask the person, I'll have presented these two ideas, we're now starting to talk about neuroplastic recovery therapies.
Mm-hmm.
Neuroplastic recovery, yeah, I guess we'll call them that. And those have two main sort of branches. One, two things that actually have some data in the medical literature. And it's all pretty early data. In other words, we don't have dozens of studies yet, but we
Mm-hmm.
have a few. And so, in one side of this is pain reprocessing therapy, and this is getting you out of that habit loop. This is teaching your brain that these sensations actually don't represent something dangerous going on in your back. They're painful, they've screwed your life up, but you don't have back cancer.
Yeah.
You're not about to become a paraplegic, whatever. Get past that. So that's pain reprocessing therapy, to watch the sensations through a lens of safety instead of through a lens of fear. Then on the other side, the other thing that keeps your brain hypervigilant, and this is these neuroplastic retraining therapies, is the pain reprocessing, getting you out of the habit loop. The other one is this getting under the hood. And the thing that we have some validated measures in the medical literature is emotional awareness and expression therapy. I don't think it's the only thing. I don't even know if it's the best thing. I don't think it's the best thing for everyone. But there are a couple of there's one really big, well-done study in military veterans with chronic pain and PTSD.
Mm-hmm.
A tough group of people, at a VA clinic in Los Angeles.
Yes.
Half of them got cognitive behavioral therapy, which is sort of a current sort of gold standard,
Mm-hmm.
and geared towards chronic pain, CBT. There's a whole program geared to versus emotional awareness and expression therapy. In other words, can you get these emotions out? And the
Yeah.
EAET group, and this was cut in group format, by the way. It wasn't even one-on-one counseling visits. The EAT group absolutely blew out of the water the CBT group as far as reduction in pain scores, reduction in narcotic use, and reduction in PTSD scores.
Wow.
So this emotional toolkit is absolute. We all have stuff under our hood,
Mm-hmm.
and I'll often ask the patient at some point. I'm like, okay, we've been talking about getting out of this. We practiced watching sensations. Maybe you're still having trouble with that. Let's keep practicing at that. Or maybe you seem pretty good at that. Let's move over to here. What do you think? Do you think there's some stuff under your hood that could be driving this? Now, occasionally it's so far repressed that they might say no, but most people who've educated themselves about this and are starting to read
Mm-hmm.
about this can understand the concept. We'll kind of go, yeah, I think maybe there is. Okay, great. Well, let's see. Let's start talking about some of these emotions. And you don't necessarily have to, dive into everything that happened. It's more, you do have to access the emotions related to that
Yeah.
event.
Yeah. Yeah. That's a lot of
Your
what
body's still holding on.
yeah, that's a lot of what I talk about in the discovery process that I do with my clients. And there's something about declaring what has happened to you, what might
Mm-hmm.
be under the hood, so to speak,
Mm-hmm.
and not dwelling on it and rehashing the past, but actually, yes, vocalizing, saying, yes, this acknowledgement is such a powerful tool of, yes, this does hurt. This was a painful part of my history. And
Yeah.
just verbalizing that, it gives you permission to move forward and no longer be stuck, because the mind unconsciously wants to pull this down and hang on to it forever because it's been suppressed for so many years for a lot of people. And being able to vocalize and acknowledge and move forward is such a powerful way to get out of that fight or flight situation that you may not even be aware that you're in.
Yes, yeah, you are hitting on just one of the key things for so many people, which is sometimes I can boil that down to name it to tame it. And there's something very powerful about bringing this stuff up into the sunlight. And this is where all these tools, this new mind-body approach to chronic pain, differs so dramatically from the biomedical approach, which is, oh, really, something's bothering you? Well, let's figure out how to maybe get that out of your life here. And
Mm-hmm.
in Mind Body, we're like, this is all about this is not about getting rid of all your discomfort, getting rid of all the bad things that have happened to you so they don't influence you. This is about acknowledging these
Yes.
things did happen to you, and they do make you feel uncomfortable. They did, and you notice
Mm-hmm.
they still do when you talk about it. And the way
Mm-hmm.
we're going to start help you get rid of your pain is we're going to actually go towards this discomfort. We're going to
Mm-hmm.
look right at it, and we're going to help your brain realize that that was then and this is now. It's
Mm-hmm.
okay to go towards it, even though your first reaction, and this is, of course, a great way to identify in people as whether and how much they need to work on these past events that are bringing up these emotions, is ask them, how do you feel as they're telling you about it?
Mm-hmm.
Okay, well, yeah, the conversation drifts into whatever, some sort of, yes, this event, and stopping them right there and go, wait, can I just stop your, what are you
Mm-hmm.
feeling right now while you're telling me this? How are you feeling? And some people will say, "Oh, I have worked through this for 10 years with I can talk about it now. It doesn't really bother me."
Mm-hmm.
And no, and they're right. I'm going to believe them if that happens.
Yeah.
But sometimes I will challenge them on that. I'm like, "Oh, I'm okay with it. It's it was a long time ago." And I'm like, "Really?" Because as you were talking about it, your brow was like this, or I saw your shoulders tense up,
Mm-hmm.
or can we just start? What are you feeling in your body right now? And
Yeah.
a lot of people, even who are denying that it's a big deal, will go, "Oh, well, yeah, as we did that quick body check-in, I am noticing some tension here." Or something.
Mm-hmm.
Okay, so this emotion is bringing this up. And they're like, "Yeah, but this isn't my main problem. I mean, yeah, there's a little of this." And I'm like, "Yeah, I know. That's because you have good coping skills. You've dealt
Uh-huh.
with this your whole life, and you don't have, we'll call it anxiety, tension in the chest. We can call it that if you want to. I don't care. You don't have to name it anxiety. I don't really care what you call it. But we did see that that thought came up, and you got some tension in your body. And
Mm-hmm.
because that's not your main problem, you blew it off. Great. We all have to blow stuff off to get through our day sometimes. But if you want to change the neural circuits, we want to start helping your brain understand that that previous event is no longer dangerous to you.
Mm-hmm.
And we do that by going towards the sense that comes up. When you thought about that, let's sit with that. And let's
Mm-hmm.
show the brain that it's okay. It's okay to name it. It's okay to talk about it. And when you do talk about it and you get that sensation, instead of going, "Oh no, I better shove it under the rug again," no, let's sit with it for a minute. You can shove it under the rug in a few minutes because you're going to have to go on with your day. That's fine.
Mm-hmm.
But I like to tell people that so many people who I see, and I'm sure you see too, I like to tell my patients, I'm not here to teach you how to cope. Most of the people I see with chronic pain have coping skills out the wazoo.
Oh
They
yeah.
get their ass out of bed every day and they take care of their family, or they walk their dog, or they go
Uh-huh.
out take care of their mom, or whatever.
Mm-hmm.
They fulfill their responsibilities. There's a few people at the very far end of the spectrum who are really debilitated, and I don't think that's because they're weak-willed. I think because these deeply seated circuits can be absolutely debilitating. Absolutely, they're terrible.
Sure, because
Um,
they've learned these behaviors of perfectionism and overachieving and putting themselves last, and
yeah.
that's been to their detriment, but that's been their coping mechanism
Yeah, or it's been something they needed to do in the
to
past.
survive.
Like they had to put themselves last to survive, or they had to do these things. But I tell most of them, you got coping, so I'm not teaching you how to cope here. I want to teach you how to rewire these circuits so you don't have to cope with them anymore. And that, for some people, involves letting go of some of your coping. Because
Mm-hmm.
so I see a lot of people who are really good at shoving stuff under the rug and getting on. And
Mm-hmm.
that's a great attribute. I would like to be with that person in a foxhole. Can they get rid of all their stuff, and can they do? Yes, there's nothing wrong with that. It's just that for most of us, certainly many of us, if that's your only strategy for dealing with adversity, is shove it under the rug and move on, there's going to come a time in most of our lives where we've shoved so much stuff under the rug we can't walk across the room anymore. And
Mm-hmm.
so this different approach involves taking stuff out from under the rug instead of
Sure.
keeping it there and saying, I can deal with that. I may not be able to deal with it for a long time, all day long. If I look at that all day long, that's not a good idea. Can I start teaching my brain that this thing that's under there, you may be good at ignoring it, it's still there.
Uh-huh.
And you can have buried anger, but I sometimes tell people, okay, this is about. I see some people who I'm explaining the concept here, and they're like, okay, yeah, no, I can see where I've got some anger. And by the way,
Mm-hmm.
mine's not repressed. I mean, I know it's there. I'm pissed off at this guy or this situation. But what am I going to do? I mean, I'm not going to go punch somebody in the nose. I'm not going to write a nasty email. That wouldn't help. Do you know what would happen if I wrote that email? Do you know what would happen to my job situation or my family dynamics? It wouldn't help. So I'll just keep it under the hood.
Mm-hmm.
You may be able to keep it under the hood. Your autonomic nervous system knows you're still angry. And when I'm
Yep.
angry, I'm hypervigilant. If I do
Yeah.
have some alarms running, I'm not going to turn them off. So this idea of getting things out can be helpful to take stress off your brain, even if it's completely unrelated. You think, well, that's not related to my back. I understand that, but your back isn't your It's your nervous system.
Mm-hmm.
And this is in your nervous system. Can you get that out? And there's of course, a lot of different ways to get that out.
Sure.
But it does have to, these emotions that are percolating underneath are often
Mm-hmm.
what's keeping people like this. So very important to address. It's not usually where I start, but, and my experience is that we all benefit by going towards those.
Yeah, for sure. I explained this in my previous episode about the pressure cooker of life. And, we add all these ingredients of stress and worry and responsibility into our pressure cooker and we seal up the lid real tight. But who's letting out the steam? Are you letting out the steam? Your parents can't do it for you. Your husband, your wife can't do it for you. Your kids can't do it for you. You're the only person who can let out this pressure cooker steam. And are you even doing it? Or is it just getting ready to implode on you? And that implosion is going to be chronic pain and disease. I have a good friend who has some stresses in her life and she's like, I'm just going to put that on the shelf. I'm just going to put that on the shelf. And I said, hey, one day your shelf's going to come crashing down, because it can only hold so much shit on top of it. And she's like, yeah, but I just don't have the time for that. And I think I see this so often, especially with friends and family who are like, I don't have time to sit and like get in the nitty gritty of what's actually going on in my life. I'd rather just, go get a massage or an injection or something. And it's so maddening to me. And I'm just like, sit with yourself for 5 minutes and you're going to save yourself so much money and so much time and so much wasted energy addressing this from an angle that your body's just going to keep coming back to it because it's the same situation and you're feeding it, but you're only suppressing it for a short amount of time before you're going to implode again.
Yeah, yeah, and it does get frustrating for those of us who have sort of really have a deep understanding, whether it's because of our own personal journey or it's because we've taken care of so many people, we see it over and over again. It's hard not to become really evangelistic about this. And go,
Yeah.
so you start seeing it in everybody.
Yeah.
And you realize that's just how brains work. This isn't a disease. We all have stuff. It's also, I think it can also be useful as a coach and it has been for me, to just let go of my responsibility. If you come to me, I'm going to educate you, but I'm going to try to do it. This is difficult for me because I'm a doctor who wants to tell you what to do. But I'm going to try to do it more with where you are now. What are you willing and ready to hear now? Even though I think there's this other stuff I should be telling you, if I tell you that, you're going to walk out of here because you're going to say that guy's full of it. Well, what about this? And having more of a little, what part of this doesn't make sense to you? Or and letting them come to it. And it can be maddening because, and I've seen people who I bring up this stuff and then I don't see them. And a year and a half later, they come back and they go, okay, yeah, I wasn't ready at that time. I had too much stuff going on in my life. Maybe they did. There is a time to put stuff on the shelf and get on with it.
Sure.
Whatever. We all have to do that. And sometimes that's because my mom is dying and my kids are teenagers or whatever. I'm not here to tell you, no, you have to approach it this way. I'm like, you do you. I'm just showing you there is a different way. If you're ready now, when you're ready, there's some real science behind this. This is how you can get rid of that problem for more than one day by going to the PT or the acupuncturist or whatever. I'm glad you have that. We all need helpful things, but if it keeps coming back, you're not getting at the root problem. And maybe now's not the time in your life to get to the root problem. That you decide that. That's not my job to tell you. But I do want to make you aware there is a larger body of evidence out there and some things you could try.
Sure. So I would assume most of the people who come see you or do your classes online or even your online work, they are all people who are ready to do the work.
For the most part, yeah. Now, it used to be, I've been teaching these classes for 6 years, and it used to be when I was with the hospital that I would just tell people that, again, there wasn't much knowledge about this, and sometimes some family practice docs would just tell them, go sign up for Brad's class, and I'd never see these people in person. So I was dealing with people who knew nothing from session one, and the class has changed dramatically, because now I start at a much higher level. In session one, we're like, okay, let's get into this a little more. Although even people who've been into this, they need that sort of reassurance and education. I just find that even the people who've done everything, Yeah, session one is mostly, in my class, I've spent mostly on pain neuroscience education, but it's fun and it's interesting how the
Mm-hmm.
brain works. And even people who are into this frequently tell me, okay, I came out with a renewed sense of confidence that this is the right thing for me. I mean, I knew it. I've been using the Curable app, or I'm working with
Mm-hmm.
somebody, or I've watched some online, but okay, no, that really cemented it. Because we do have to keep exposing ourselves to these. These
Mm-hmm.
ideas aren't quite completely fully out there yet. They're starting to get into the collective unconscious, but
Mm-hmm.
or collective consciousness, whatever I'm calling that. But you do have to look for this. We're never going to be scrolling through YouTube and an ad's going to come up that says "fix yourself for almost nothing." That ad will not come up. The
Yeah.
ad is the Laser Spine Institute or the supplement that you must be short on, and can you
Uh-huh.
this? And as I said, I had to leave the hospital because they're like, "You're not making us any money. Talking to people doesn't make money, but
Mm.
it's what cures people." So
Yeah.
you do have to go looking for it because the money making community is not going to be having tons of ads for this. But once you go
Mm-hmm.
looking for it and you understand that, oh, there's this app. Oh, there's something called the Association for the Treatment of Neuroplastic Symptoms, an organization founded by doctors to treat these kind of hard to treat medical problems and to give you some resources where to go and practitioner directories and things like this, and some tools on their website. Once you start opening your brain, oh, there's this book and there's that book. Oh, wait a minute.
Mm-hmm.
There's a book called The Way Out about chronic pain by this guy, Alan Gordon. Okay, some LCSW, runs a pain psychology clinic in LA. Oh, look at that. The foreword of the book is written by literally the world's leading neuroscientist on pain research. Certainly one of these. The guy's the head of neuroscience department at
Sure.
Dartmouth College in New England is where he's working right now. And like, okay, wait a minute. There's some real people talking about this stuff. But
Mm-hmm.
you do have to kind of go out and look for it because it doesn't come to you just because that's the way our system works. It's not a big money maker.
Absolutely. Yep. It's an interesting world. When I first got into it, I didn't know any mind body coaches. I didn't know any doctors that knew anything about mind body coach. And this is 2015 to 2018. I'm the first mind body coach that I even knew. I
Yeah.
basically made it up, but based on everything I'd experienced and what I knew, and I knew what worked for me and my husband. And then I couldn't keep my mouth shut, shouting it from the rooftops to every person who walked by with a limp, you know.
Right.
and
Yeah.
and now it's pretty mainstream, and the collective consciousness is starting to grasp there's something to this. There's so much more power that we actually have. And, my whole podcast sub tagline is reclaiming the power within. And I think people so lose track of turning their power over to, a doctor to give me a prescription or a surgery, or just, tell me what to do. And it's just like, where is your responsibility for yourself? You intuitively should know, but we've given our power away to everybody else, and we've not reclaimed it for ourselves yet, for the most part.
Right, and we also, there are a lot of people who might be listening to you talk like that who say, "I'm not. I've claimed my power, man. I know how to get stuff done. I've got to. I don't let myself. I don't go easy on myself. I tell myself, you can do this. You can do that. That's again great attribute, but if you have chronic pain or other chronic hard to treat medical problems, the gritting your teeth, again, great attribute. It might get you through the next 10 minutes. It might even get you through the day. You might wake up every morning and go, God dang it, I'm going to, and you might, good for you, but if this is interfering with your day at all, if it's in the background, you kind of wish it wasn't there, and your only tool is to do this, there is, I just want to get past the mistaken belief that we're going to, that you, when you're doing your coaching, oh, let me just teach these people how to better grit their teeth.
No.
Again, most of these people are already really pretty good at that. They're very good
Yeah.
at it. We want to teach them a different set of skills, but that involves a little bit of letting go. I remember I had an airline pilot once, and he was really good at figuring stuff out, solving situations, and quite frankly, I would like my airline pilot to be good at that. If something happens, I hope he knows how to do that. I
Sure.
hope he's really good at not panicking in an emergency. I hope he's really good at when something goes wrong, checking all the buttons. I hope he checked those buttons before we took off. I hope he's a little OCD, quite frankly.
Yeah.
So these are good qualities of, okay, I got this, I'm on top of this, and when there's adversity, I'm going to react like this. Nothing wrong with that. It's just that some people are so good at that they think I'm going to use that to treat this problem, my chronic pain or my chronic fatigue or whatever. And that attitude will not solve this problem. It's not. It will get you through the day, but you're not going to change the brain circuits with that. You may overpower them for the day to get yourself through the day miserably, but you're not going to change that. You want to change the circuits? That's a different set of tools. And so that can be an intellectual thing to overcome for people who have their whole life overcome a lot of adversity. And that's why they even got where they are today. Good for you. It's just letting go of that, and not letting go of that ability in the rest of your life. But in this arena, we want to back off and not be so about it.
Yeah, because that's just hypervigilance all day long. That's not going to serve you in any shape.
Right. And the idea of being a little kinder to yourself. There are a lot of people who don't, they're like, what do you mean? No, I'm not going to have a pity party. No, this is how the reason I have, you don't know the adversity I've been through. I know how to, no, I told myself to suck it on. So,
well, that's probably what their parents talk to them like that. Suck it up. You're fine.
Correct.
Toughen up.
Correct. Yeah. And so anyway, we're all in different places, and I just want to, it's important when we see those kind of things. I'm not telling those people that they're even wrong for how they're, what has gotten them through life. I'm just saying, if you have this problem, we need to step back, and that can be a hurdle for some people.
Maybe just tell us some things that you would say to some skeptical listeners at this point.
I'm kind of like, my job is not to convince or persuade you. I actually think we rarely persuade someone away from deeply held beliefs through intellectual arguments. We persuade people through more, often more embodied activities. So one thing that I'll do for a lot of people early on, and maybe anybody listening to this could try this right now, whether you're skeptical or not, is just start noticing what your body is doing. And right now, can we just all take 1 minute and turn your attention to your body and ask yourself, just in your own mind, no out loud answers here, what sensations can you feel right this second in your temples, if anything? And nothing's an acceptable answer, but just noticing really closely. Anything, a buzzing, a pressure, and maybe it's nothing, but just feel into that. What can you feel in your jaw? The left side, the right side. What sensations can you feel in the back of your throat as you breathe gently in and out, if anything? Your neck and shoulders. What is here to feel? Your chest. Any sensations in your chest at all? Maybe, maybe not. The abdomen. Might be an internal sensation, could be external, like a shirt rubbing on it as you breathe. Can you feel anything in your abdomen? Pelvic floor. Then we can be done with the exercise. And what I like to ask people after that, or ask anybody who's listening, did you feel anything in any of those places? And I don't know what you felt, Heather, when you did that. I know you've done these kind of things, but did you notice anything?
Yeah, sure. Racing heart, tightness in the jaw. Yeah.
Okay. So we just checked in with your autonomic nervous system. And we saw that this part of your brain that runs your whole body, it runs your heart, your lungs, your bowel, your bladder, your sweat glands, your immune system, none of that stuff just happens. There's a conductor in your brain, and we just checked in with it. What are you doing to me right now? Oh, you're pounding my heart. Oh, you're putting a little tension in the jaw. Okay, yeah, I see that. And the autonomic nervous system right now is processing that experience. It's going, what the hell was that? We just found some tense areas. I barely knew they were there before I did this because I'm good at ignoring it and having some stuff I have to do here. But they were there. Usually when you notice, I often tell people to think about themselves having two different brains. You got the brain that's running you, your lizard brain outside of your conscious awareness, and you've got your cognitive brain. Your subconscious brain is going, wow, Heather, the boss, just stepped down, and she watched what we're doing. She found that we were a little tense in the heart and a little bit of tension in the jaw muscles, and she didn't tell us to shut up. She didn't tell us, oh my God, will you stop that? And she didn't say, oh, you know what, I'm glad it's not that bad. I think I'm going to ignore you right now. She actually stayed with it for a moment. Then she went to another tense area. She just kept moving through the body. Usually when I bring these things up to her, she either ignores them because she kind of doesn't want to look at them. She's a little worried about them. Or she kind of tells me to shut up, or tells me I should do a breathing exercise or something to calm it down. Those are all fine things you might want to do at times, but that was different. This time she turned towards, she saw it, and she just said, oh, I see what you're doing, and she didn't even react. I thought we had to react, either by ignoring or running away or trying to fix. We didn't do any of that. We just sat with it for a few moments and moved to the next area. I didn't know that was possible. So we're showing the brain, this subconscious brain, that these sensations, even though they're mild, but we're showing the brain that the body is a safe place, that these sensations, we don't have to run away from them. And I'll often start with these milder ones. Let's not start with your worst thing. That's hard to look at. Let's find other tension that you think isn't your problem. I realize it's not. Any message we can give to the brain that the body is a safe place, so we can start somewhere different. So really the message that I would give to any skeptic is education, and every week I probably have a different thing that's at the top of my head. Just recently, and this is actually a few weeks ago, I discovered this. There's an organization called Big Think that interviews people, puts 1 hour videos on of all sorts of big thinkers. Anyway, I found this one there they interviewed, and I would encourage people to find this, although there's a million other things, but this is near the top of my list now, on YouTube, where a neuroscientist named David Linden, I think, at Johns Hopkins, is talking about the mind-body connection. And very reputable, older guy, clearly published tons of stuff, and he just sits in a chair and he talks in a really interesting, fun way. Even I show in the first few minutes of this to some classes that I teach, just to get people to see this is like a frickin' mainstream neuroscientist talking very specifically about the mind-body connection and how real it has become in the last decade. So often for people who are skeptical, I'm like, look, my job is not to get you to come on board in 1 second here. But if you're interested, and if you're not interested, then you're not interested. Okay, then you do you. But if you are, look at some of these educational materials. And so, I've got a list of educational materials and things you can look at, books, podcasts. That particular video right now is near the top of my list. Just start educating yourself, and then you decide. I don't have to decide for you. Look at this. Instead of me convincing you, I'm just asking you, or recommending, or suggesting that you open your head to the possibility. And if you look at it and you decide this isn't for you, then guess what? It's not for you. If you look at it and you decide this is a bunch of BS, then guess what? It's a bunch of BS for you. Fine. I don't care. I can't fix everybody. It's not my job to fix you. My job, as I see it right now, is to let you know there's some information out there, and if it makes sense to you, I'd love to go down that path with you. And if it doesn't, see you later. Not in a dismissive way. You figure out what's right for you.
I love that, Brad. Yeah. Thank you so much for being here today. Where can people find you?
I'm online at bouldermindbodymedicine.com. That's where I've got.
As well as YouTube.
Clinic. Oh, and I'm on YouTube at dr.fanestil. Dr. Fanestil, but it's dr.fanestil.
Yes, lots of lovely, important, great videos on there.
Right. I love doing those. Yeah, I'm trying to get into a habit of once a week or so putting some little thing out on there. So, yeah.
So good. Well, I so appreciate it. Everybody, Dr. Brad Fanestil, Boulder, Colorado, thank you for being here. Thank you for joining us. And we will see you next time in the Pain Free for Good podcast. All right. Thank you for being here with me today. If something in this episode resonated with you, just know that awareness is where our power begins. If you feel called, share this episode with someone who may need it. And don't forget to subscribe so you can continue this journey with me. Until next time, keep listening inward. Your body, your intuition, and your truth already know the way.